Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Nirvana Manning, and she is the chair of the Department of Obstetrics and Gynecology at UAMS and the director for the Arkansas Center for Women's and Infants Health. Dr. Manning, thank you so much for being here today.
No, it is my pleasure. Thank you for having me, Robin.
So we've been hearing a lot about the maternal health care crisis in Arkansas. Can you start by helping us understand what that really looks like? Where do we stand right now compared to the rest of the country?
Yeah, absolutely. So I think this has all kind of come to light in the last several years, much more so, which is why we're hearing about it a lot. We are ranked as number 50th in the nation with regards to maternal mortality, and that's maternal deaths in the first 365 days after giving birth. We developed the Arkansas Maternal Mortality Review Committee with legislation in 2019. And so the purpose of that was to be able to have an organized body with which we can kind of systemically and systematically look at each of these maternal deaths and determine kind of where we missed the mark, what we can do in the future. Is it a healthcare issue? Is it a community issue? Is it legislation that's needed? Is it something else that we need to wrap around? And so it really allowed us a lot more information. And now we have about 5 years worth of data that we look at. And so we sit in this committee and really look at each of these maternal deaths and have players from all across the field, from social work, from the coroner's office, from the police department, from cardiology, and you name it. We sometimes even think of someone else and we're like, we need to add this person to this team to kind of talk about where we can improve things. And then every year we do a legislative report on kind of what we think are the highest, like the lowest hanging fruit with regards to kind of making things better. The newest iteration showed that 94% of these were likely preventable, which is really sobering. And so this is, what I do every day. I'm an OBGYN by trade. I love what I do. And so sitting here and you're like, oh my gosh, how are we missing the mark so often? And I think what is important to understand is it's not just one piece of the puzzle. When we look at this, when we look at these 94% that are preventable, I would hope that a suicide due to opioid overuse, we consider that preventable. We consider, so many elements along the way where they could have gotten help and maybe the system was unable to serve them. Maybe they didn't know to go and get the help. Maybe the provider that was there didn't recognize the issues. So there's so many kind of elements along the way that we look at and hopefully create a better wraparound, because I wish it was just a magic bullet. And if we fix this one thing, it would fix this whole problem. But that is why so many people right now are working in this area, is because it is so multifaceted. And so, yes, this part of it in my world is one big part of it, but there's so many other big parts that we're trying to tackle at the same time, just to make sure that Arkansas families know that there's resources and we're working to make things better.
So what are the main drivers behind the outcomes? Is it medical complications, access to care, or is it something deeper in our communities?
So, I think that's a great question. When we look at it, we kind of break it down into when did this happen? And there's several different categories, but I'll talk about pregnancy related. We have pregnancy related, pregnancy associated, and then kind of we don't know, but we know it was around the time of pregnancy. So pregnancy related is the most directly correlated. And of those, probably it's about 30% of those maternal deaths happen either during pregnancy or on the delivery day. You get another 15% in that 1 week afterwards. So 45% is around pregnancy and that 1 week afterwards, right? Then you go to that 6 week, kind of the historic 6 weeks of postpartum, and there's another 20%. And then from 6 weeks on till that 365 days is 35% of these deaths. So each of those comes with its own set of unique issues. These initial parts, this initial 45%, is medical care. It's access to care. It's getting to the right place at the right time. It's having the blood products in your hospital. It's having the expertise in your hospital. It's recognizing kind of some of these never events. And so some of these smaller hospitals that may not see but 400 to 500 deliveries a year may not have an obstetrical emergency, but once every 3 years. So how can we ensure that everyone that touches that patient, even if they're brand new, knows exactly what to do in the right amount of time? That second chunk is kind of the things that they go home with and they're going to have to call back. So family, friends, patients, doulas, community healthcare workers, who's recognizing that this mom is not doing well. And those are kind of our infections, our cardiovascular stuff, our cardiomyopathies. And then that last chunk really falls a lot with our opioid abuse and use, as well as mental health. So they're very distinct things that just kind of have to be treated very differently.
And we know outcomes vary widely by race, income, and geography, especially in our rural areas. What disparities are you most concerned about, and what's being done to address them?
Sure. So our Black non-Hispanic patients are one to 1.5 times more likely to die in pregnancy. We know this. This is what the data shows. Now, the why is the part that it's like peeling back a onion. There are so many different, is it trust of the system? Is it access to care? Is it insurance? Is it proximity to a hospital? Is it the ability to get transportation back and forth? I mean, there are a myriad of reasons, all of which need to be addressed. Some of which are being done with different grants and different work. And there's so much. I think, what has been the most exciting for me, having been in this. So I've been out of residency now. I'm going to age myself about 19 years. And it's only been about the last six to seven that we have really talked about this. We've gotten groups of people. We are all kind of swimming in the same direction. And what's so exciting to me is how many people are willing to jump in, willing to roll up their sleeves and do whatever little part they can do. And it's all of those, the sum of those little parts that are going to ultimately move us in the right direction.
So for our healthcare professionals watching, what are some key things clinicians, nurses, care teams can do differently right now to better identify and support women at higher risk?
So I would say, ask for help. There are resources in our state, and sometimes it's very difficult to find those resources. We have developed the Arkansas Center for Women's and Infants Health, and that the website for that is myarkansasbirth.org. And on that, we are trying to kind of conglomerate most of our resources that we have. We have these projects that we're working on under there. But one of the ones I'm the most proud of is this proactive postpartum call center. And the idea behind that is that we will proactively call every patient in our state between 7 and 10 days postpartum. And we will go through a very kind of distinct set of medical questionnaires, including some social determinants of health, and do they need help with the reapplication process for Medicaid? We are currently the only state that does not have extension of Medicaid to 12 months. So Medicaid, and over 50% of the deliveries in our state are insured by Medicaid. And Medicaid ends at 60 days postpartum or the end of that month. So those women then do not have coverage unless we reapply. Now, there are great options for reapplication. It's just super cumbersome and it's hard. It's hard for very, well-versed in this area people, much less if you're overwhelmed, have a baby at home, trying to raise a family and do all this. So we are hoping to kind of bridge that gap and help people with that reapplication process so that they have coverage. So I think reaching out to us on that, UAMS also has a call center. So I think imploring us to all work together more and differently and kind of develop those relationships in a different way and kind of rely on each other for what we can. We did our first roundtable with all 33 of our delivering hospitals about 3 months ago. And it was so fun to get all all of these kind of CEOs and nursing directors and talk about what's unique in some areas and how we can help facilitate that in other areas. I mean, what we need in rural Arkansas and the Delta is very different than what we may need in Central Arkansas or Northwest Arkansas, but how can we help bridge those gaps? And I think, right now it's very sobering that we are number 50th, but what it has allowed us is grant funds and attention that will help fund some of these ideas. So it's a great time to kind of start developing what these relationships can be so that we can build on that and kind of make us all work together in new and different ways.
So beyond the clinic walls, you touched on this a little bit. Let's talk about partnerships specifically. Are there community efforts that are making a real difference in improving maternal health?
Yeah, I mean, there are tons of community efforts. And I want to give a huge shout out for the legislation this last session. Governor Sanders has made maternal mortality and maternal health a big issue for her. The passing of Healthy Moms, Healthy Babies really kind of set the precedent for a lot of things that needed to happen. And that's one big piece of the puzzle. Then there are different organizations, doulas, community healthcare workers. There are tons of legislators that are kind of dug in and saying, like, tell me what I can do, tell me this small piece, and let me take it from there and see what we can do. So I have been so excited at seeing just so many people pull up to the table, no matter where you are, because I think women's health is a completely bipartisan issue. It affects all of us. It affects our families. It affects our state. And we're committed to kind of making that better for women and families. And we know that when women and families are doing better, they do better for the infant, and those children will do better and thrive. We know that that's also an area we're lacking in our state.
So one last question.
Sure.
If you could share one message directly with expectant mothers, families across Arkansas, especially those who might feel disconnected from care, what would you want them to know?
I would want them to see that there are so many people on their side. There are so many people that are working for them, that if they feel alone, if they feel isolated, there are resources. Certainly, the Arkansas Center for Women's and Infants Health will be happy to do that, but to reach out to even one and be able to find other resources. And again, there's the Pregnancy Plus app, which is also a statewide effort that really is meant for our state with resources specific to Arkansans. And it is there. It is free. It is, utilize what you can. Don't be afraid to kind of ask for help. I think someone gave me that advice many years ago when I had really small kids, that you will never regret having asked for help. And I think it holds true in so many different parts of life. So it's not a weakness to ask for help. It's a maturity to know that, sometimes things are just not in our control. And there are people out there that really do want to make things better.
And is there a website where you can find out about this app, about these programs, different things?
So myarkansasbirth.org is a website, and it has a link to the app. It has tons of other resources we have in our state. It also has videos. If you're, at 3 a.m., if you can't figure out this breastfeeding and it's so overwhelming and you're in tears, there's videos and things to be able to help you do that. It also, the idea is to hook us back into resources in our communities. We want to build up those communities. We know we need every one of these 33 delivering hospitals to continue to serve moms and babies, because every time one of these closes, it leaves a huge gap in care, and women just cannot traverse hours to get to prenatal care visits. So we want to help support and bring people back into those communities whenever possible. So that's another thing that I love about the convening of the 33. How can we better support? How can Central Arkansas support kind of the corners of our state? What do y'all need that's different? And how can we kind of bridge those gaps with some of the efforts that we're doing, you know, with mobile units, with telemedicine, with so many of the things that this last legislative session kind of really set the ground for, and we're so thankful for. How can we now help these communities build those up?
Well, Dr. Manning, thank you so much for talking about these important initiatives and for all that you're doing for the women and babies in the future of Arkansas. Thank you.
Thank you so much. I appreciate it.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.